halt. Joining me now, one of the first American doctors set to get this potentially life-saving vaccine. Dr. Nick Gilpin is the Director of Infection Prevention and Epidemiology at Beaumont Health. Your hospital, as I understand it, has just received its first doses of the vaccine. You'll be the first person in the hospital's health system to take it. How are you feeling about that?
Yeah, I feel really good about it. I think that this is an opportunity for me as a leader in healthcare to put my money where my mouth is and really show all of our healthcare workers and hopefully the public that we feel confident that this vaccine is safe and it's effective. And I think that that's our job as leaders and as healthcare providers, is to be ambassadors for a vaccine that we all frankly believe is going to be our ticket out of this pandemic.
Yeah, your hospital says that you have led the charge in the vaccine rollout. Just walk us through that process, if you will.
Sure. Well, you know, beginning back in March of this year, when our hospital and healthcare system got hit the hardest, that's when the conversation around a vaccine really started to begin. And it was a very theoretical discussion, but we took the opportunity in the slower summer months through June, July, and August to really bolster our supply of personal protective gear, but also to start ramping up our logistics and supply chain to make sure that we were ready for when a vaccine would arrive, because we believed in our hearts that a vaccine could arrive as early as the end of the year, and sure enough, here it is. Those conversations have gotten less theoretical and certainly more tangible over the last few weeks, as we've actually now got a clear timeline. And as you pointed out, we just got our vaccine today. So the next plan is going to be to distribute it to our 38,000 employees, our 5,000 physicians, and then eventually to the public.
You have said, and I've got a quote up here from you, that taking care of COVID patients has been humbling, to say the least. How stretched have you and your colleagues been, and what sort of toll has the last, 9-10 months taken on you and your fellow clinicians?
You know, it's so difficult to really put it into words, and I guess the one thing that has been our most precious resource throughout this entire pandemic has always been our staff and our providers, our physicians, our nurses, our respiratory therapists. And they've had to come to work day in and day out, don the personal protective gear, care for the patients with really no break, with no respite, and emotionally, psychologically, that deals such an incredible blow. We can get more PPE, we can get more tests, we can even make more beds if we have to, but we can't get more staff, not quickly, not easily. So making sure that our staff has been taking care of themselves, making sure that we're doing everything we can to keep our staff safe has been absolutely mission critical. I think this vaccine comes at a great time, because now I hope this is going to give our staff some relief as we start to pivot into the more difficult winter months.
And you talk about these difficult winter months, and Dr. Anthony Fauci has said, of course, that the public shouldn't or won't be able to throw the masks away, as he describes it, until the late fall or early winter of 2021. Do you share his concerns about there being light at the end of the tunnel, but in trying to ensure that people understand that this thing ain't over until it's over?
Right. Dr. Fauci said it well. He usually does. And he's right that even though we're going to be delivering a vaccine to healthcare workers and eventually to the public, it's still important for us all to continue to practice those mitigation strategies that I and others have been preaching: masking, social distancing, hand hygiene. Because the important question here is, we know that this vaccine can prevent disease, but will it really stop transmission in its tracks? Will there still be a possibility of people, even once vaccinated, to be able to spread the virus to others? That's an important unanswered question. I know that scientists and the vaccine manufacturers are going to be working very hard to answer that question. And once we feel like we're on good footing, then we can start to have a more meaningful conversation about ditching the masks.
With that, we'll leave it there. Listen, good luck. You know, I hope you and your colleagues, you know, benefit hugely from this vaccine, both physically and mentally, because we realise that it has been such a tough time, and all we can do is applaud you. And please carry on the good work. Thank you. Thank you, Dr. Gilpin.